Hello everyone, welcome to the SRQC's official YouTube channel. I am Vibhavi, currently a final year medical student at the SMS Medical College, and on behalf of the entire SRQC team, I would like to welcome you all for today's session, which you can very well see from the title of this video is going to be about PLAB. So today we have Dr. Shruti Saxena with us. Welcome, boss.
Hi, thank you so much for having me.
Our pleasure was. And she is currently a final year GP trainee at the Thames Valley Deanery, Oxford, UK. And she also is an alumna from our college from the 2012 batch. Was it is amazing to have you here, and thank you so much for agreeing to be a part of this session.
Oh, absolutely, no problem, ma'am. It's my pleasure.
Okay. So the purpose or the motive of this video or this session is to make you all a little bit more aware about PLAB as a career option. And for those of you who do not know about PLAB, this video will for sure help you get more acquainted with the entire PLAB pathway. First of all, let me give you all a brief idea about what actually PLAB is. So PLAB stands for Professional Linguistics Assessment Board. This is an exam that the doctors who have qualified outside of the UK must take to practice medicine within the UK. And this exam is consists of two parts: the part one being a written exam, and the part two being a practical exam. So without further ado, boss, let's begin with the questions.
Yeah, okay.
Okay, so was PLAB is a pathway that not many dare to pursue, and was you having trodden on that path makes you a very rare and extraordinary person. So was what actually made you decide that you want to take this path less taken?
All right, okay. So first of all, I don't think I'm an extraordinary person. I think I was just there at the right time. That's it. To answer this question, I think there are three parts to this answer. First of all, me figuring out what I liked, what I wanted to do, and what I was willing to really give up in order to leave my own country. Second was the financial, where I was considering is it going to be better for me in the long run to actually leave India, not be here, and was it again worth it to actually have left my family and friends behind? And third was the work-life balance. So around my final year, I realized that I was not probably one of those people who could go on with the typical residency pathway in India, where you don't get sleep, you don't get a lot of time off. It trains you to be an absolutely amazing doctor. But for me, rest, leaves, and time and quality of life were quite important. So I decided to look into areas that could offer me that. I ended up looking into UK, US, and then Canada. And yeah, I mean, I talked to a few people, doctors, alumni from our college, and I realized that okay, UK offers a very good work-life balance, and your time is quite valued here, and you can very rightfully ask to be left alone when you're not working, and no one gets offended. So I really like that, and I did realize that financially UK wasn't as lucrative as US and Canada. But yeah, that was kind of not my first priority. So I went for it.
So the major thing that you thought while choosing to pursue PG from UK was the work-life balance, and fair enough, boss. So, boss, can you please walk us through the entire pathway, matlab, briefly?
Okay. So firstly, you basically start with doing your English proficiency test. Okay. And you need to do it in a time where you know that in 2 years' time it's going to not be valid. And when you apply for your GMC registration, it should still be in A. So decide to do it around the time when you know that in 2 years' time you will have actually applied for a registration here.
Mm-hmm.
You do IELTS, OAT, either. Then once that's done, you make a GMC account. You give them your degree. Then you basically get it verified by them and then independently by CFMG. Along with that, they also ask for a good standing certificate as far as I remember. And after that, you do your PLAB 1. You can do PLAB 1 in India or various countries really. and then PLAB 2. PLAB 2 is definitely in UK, so you will have to be present here.
Okay, so boss, we can appear for PLAB 1 within India, but PLAB 2 is in UK, so we'll have to fly there.
Yeah.
Fly to that place. Okay. So, boss, where does one register for this exam, and when does one register for this exam?
It really depends on you how much time you want to give yourself. There's no rule here, but it depends on how long you think you'll take to prepare and where you are in your internship, and where if you've done your IELTS or OET, whichever it is. So for me, I did it after my internship because I took my free time to even decide what I was going to do. And from the point of view of my Indian counterparts, it was time waste. But yeah, I mean, I wanted to take that time, so I did that. So I actually decided after internship, I did IELTS, and I then actually did a 3 months job in Jaipur in a private hospital. Then then I did my PLAB 1 outside of India, and then I came back, did another job in another city just to gain more experience before doing my PLAB 2.
Okay, so boss, there is no strict rule that one has to go by. One can do whatever suits them the best, right?
But kind of try and do this within a 2 year period because, as I said, your English proficiency tests will expire.
Okay. And was this English proficiency tests thing that you were just mentioning? So was, I guess there are two tests that they accept. Well, the first one being IELTS and the second one being OET. So what was, how do they exactly differ, matlab, with respect to?
So from what I've heard, I've only done IELTS, and before IELTS, I think I don't remember why, but I think I was preparing. Oh yes, I was also considering US, so I had already gone on the pathway for TOEFL. Did not end up doing that. But yes, IELTS and OET are quite similar. I have heard people say that OET is easier, and it might as well be. But the main differences basically are OET is more professional based, so it is for healthcare professionals, and it could be anywhere ranging from doctors, nurses, paramedics to your allied professionals like physiotherapists, optometrists, various professions. So it is basically for them, and IELTS is for a wide variety. So IELTS can be asking you to talk about, write about, and read about various topics on the earth, whereas OET is quite it explains you quite well a healthcare topic that you're expected to talk about and write about. That's why we find it a bit easier.
Okay,
Also, IELTS, there's a band system in IELTS, 1 to 9, you get scores, and in OET it's grade A to E. And IELTS, I think, for GMC for doctors, it would be, I think, a score 7.5 or above, and a band 7.5 or above, and not less than 7 in any section.
okay,
And for OET, it's the equivalent B, grade B.
okay. So basically, IELTS is for everybody, and OET is more professionally oriented, so people find it easier.
Yeah.
Okay. And so, boss, can we now talk about PLAB 1 in a little more detail? Like, what is the pattern of PLAB 1?
Yeah, so PLAB 1, as we know, is the first exam that you do. It is a computer-based exam, multiple choice questions, single best answer. Okay, and you get 180 questions, and you get 180 minutes for it. So precisely 1 minute per question, or more if you answer the others in a shorter duration. The subjects are more final year life, but you have a bit of physiology, pharmacology as well.
Okay.
The important thing to consider is all of us having done our medical education are more than good enough to really have covered all these topics. So it's not that difficult, but the thing that needs to be given a bit more attention and effort is you need to be familiar with the recent updated guidelines in UK, and they will expect you to answer questions based on that. Because all of the answers can be correct, but they want to pick something that is as per the recent updated guidelines.
Okay.
Um, yeah, it is a pass-fail exam, and you don't have to really. It's not like you're going to get a rank, but there is percentile. But above a certain percentile, all of you will pass, and there will be no weightage given to how much you actually scored.
Okay, so there is no ranking system over here.
Yeah.
Okay. And was now after and was what were the resources that you used while preparing for PLAB 1 or that you thought were really helpful?
Resources, there are thousands of resources you can use, depending on how deep you want to actually dive into the curriculum. The best resource that everyone definitely does is Plabbable, and basically it's a question bank, and you go through a few questions, you do tests on there, and ideally, if you're expecting to really not do more attempts, then I would say go through the entire question bank at least twice. Be very sure that you're going to answer the questions as per the answers on Plabbable, and you're quite familiar with the guidelines that Plabbable answers have in their explanations. Other than that, there are lots of notes and resources that lots of academies have floated. Once you have done Plabbable, I would suggest that you do at least some mock tests before actually taking the real exam, because um, mock tests can be a bit more difficult or easier as compared to Plabbable, and that will at least let your brain be ready for an exam that might not exactly look like Plabbable. So definitely do that. Usually 2 to 3 months people take to prepare for that, but it could be shorter for you if you're quite fresh with your knowledge at the time, and it could be longer for you if you've had a break. So it really depends.
Okay. So was after PLAB 1, how do things proceed for PLAB 2?
PLAB one, once you pass the PLAB one, you can apply for PLAB two right away. And PLAB 2 is obviously in the GMC building in Manchester, UK. So you have to be here for that. And of course, I appreciate now it is more difficult to get tested even. It probably wasn't as bad. Or it was a bit, yeah. It has become more and more difficult to get tested. So I think as soon as you get your results, just be on it and book your next one, because the dates go out in minutes. Um, for PLAB 2 specifically, you can choose either to prepare from home in India, or you can choose to come here and actually prepare with an academy or friends if you have people who are doing it with you. So there's quite a lot you can do. We can talk about PLAB 2 in detail, because that is something that me coming from India, I was not familiar with.
Okay. So was these academies thing that you were talking about, is it like necessary for us to get enrolled in them or can we do it with the help of our peers only?
Um, So the benefit of joining an academy is that you will have someone who will have been in the system, actually evaluating your progress, giving you pointers, and telling you how to really interact. Because that too is a bit of a comprehensive exam, and you obviously are there face to face with a person who's actually an actor. And these actors are very well trained in how to behave as patients and what to say, how to interview, and it can throw you off very easily. And sometimes they will just introduce new stations that you have not heard about or thought preparing. So it is better if you actually have that sort of system and environment to practice in. You can actually prepare online from India. A lot of academies do that. That might suffice, especially for stations where you're just communicating with the patient. But there are stations where you'll be expected to demonstrate a clinical skill, to interpret results quite quickly, like they might give you blood gas results, or pathology biochem results. They might give you radiographs, and then there are mannequins that have actual findings, such as there might be an abdominal mannequin with a palpable mass, or there might be a resuscitation station, which is one of the more difficult ones, where a mannequin will be very lifelike, and they will actually talking to you, and it is it's very very strange because I'd never seen anything like that.
Hmm.
And one of the practice sessions, the mannequins, they were mannequins, but they looked less human. Whereas
Oh.
in the exam, my mannequin was so human. It literally had body hair and eyelashes, and
Oh.
I was like, wow, okay. And then there's always an examiner in the same room with you, evaluating what you're doing and clicking buttons on their own computer to get the mannequin to say what they want them to say. So it's better if you have a physical interaction with such things and your peers and people who are training you to actually
Hmm.
prepare yourself really well for it.
PLAB 2 sounds like quite an unconventional exam, not the regular ones that we are acquainted to giving.
Yeah, I think because it's an OSCE, they do look at quite a lot of things. They will look at your knowledge, they will look at how quick you can actually be. Because there are 18 stations, and so you imagine like you're in a queue, all of the applicants for the exam, and then there's a bell. So all of you line up on successive stations. There are 18 doors, and behind that door is that case. On the door, there is a sheet of paper that will explain very briefly something about the case. And in your mind, you get 2 minutes to prepare, and you might be preparing for something completely different. And when you open the door, it does not turn out to be what you thought it was. So yeah, it is quite different. And then there's concentration skills that they really focus on. So they want you to be non-judgmental. They want you to be really calm, collected for difficult situations. Because some stations are specifically designed to really make it difficult for a doctor to actually talk to that patient. The patient can be angry. The patient can be complaining. You might have to break bad news like cancer for the first time.
Okay.
Um, then there are some patients where you'll be expected to specifically be non-judgmental and have a bit more empathy, such as fertility consultations with transgender people, where they might want information about transition, again information about actually having babies and things like that. So, along with knowing the recent guidelines, you will be expected to feel all of that as well. So, practice is really important.
Okay, so I guess PLAB 2 is the one that actually demands a lot of preparation rather than PLAB 1.
Yeah, PLAB one I think is something that we're exams where we're all used to doing exams. I think it's quite easy
Hmm.
as compared to PLAB two. But
Hmm.
yeah, and it's also fun because you get to make new friends. So
Hmm.
I came to Manchester in January 2020, and my exam end of January, and my exam was in March,
Okay.
and was right when COVID happened. And on my exam date, we got two new stations that none of us had heard about, and we were all shown off. Thankfully, I passed, probably because I had a bit of work experience myself before actually doing the exam.
Hmm.
But I came out of the exam, and we all got told that there's a lockdown that's going to happen. None of you can actually go back to India, and there are going to be no
Oh.
more exams. So my friends actually got unlucky and they couldn't take their exams.
That sounds terrible.
Yes, and of course you're in a new country, you don't know people. So
Hmm.
yeah, but that's not going to happen. Hopefully again. Yeah.
Hopefully, was also this thing that you mentioned that there are actually actors acting as patients is something that I did not know. I thought that they would be real patients that we would be given to work upon.
Yeah, no, they're really good actually. They're amazing. And I remember for my visa station, the mannequin was so lifelike, and I had a nurse to help me out with life support and weight pressures
Hmm.
and loading things and doing calculation and all of that. And she was I don't know whether she did it to throw the candidates off, but she had the longest fake eyelashes I have ever seen. And again, that was something I was not used to. So in 8 minutes that I was given to actually save that patient, I was just trying to acclimatize myself to the
Hmm.
new stimuli that I got in the exam. But yeah, that was really interesting, and I did manage to save that patient. I was quite proud of myself. That was a new case for us as well.
That is quite an achievement, was in itself, to actually appear for such exams and you're thrown off with such unprecedented cases.
Yeah,
Okay,
but
so
you did do it once you
hmm. So was moving on to the next question. While I was researching for this session, I came across the fact that many IMGs, after passing PLAB 2, get themselves enrolled in some sort of a clinical attachment or maybe an ALS course to improve their CVs. So, was what are the various options available to us?
Um, it depends again. I think in my experience recently, they're not doing a lot of clinical attachments. But the best advice would be to figure out where you will be able to comfortably live for a period of time, because it is uncertain whether you're going to get it or not. And if you have gone back home and want to come back for something, it gets all the more difficult. So give yourself 1 or 2 months after your PLAB 2.
Okay.
Hopefully, people have sometimes they have friends or family, or you rent out somewhere. And then you send emails to the HR department of all the hospitals and departments in the area where you are able to actually stay. Some of them might come back with a response to say that, okay, fine, come do a clinical attachment. Um, don't be very picky about which department you want to do it in, because especially where you want to go, because all you need to really get out of this is just see an overview of how NHS actually works. So if you get it, it's really good. Sometimes some contacts pay off, but departments aren't really, there's no gap there to fill. So they're not bound to actually get people for clinical attachments. That's why it's a bit more difficult.
Okay, so it totally depends upon the hospital. They might be kind enough to offer me one, but they are under no compulsion to offer me one.
Yeah.
Okay, so boss, I guess after passing PLAB 2, now that I have my GMC registration, I am now eligible to practice in the UK as a doctor. So, boss, what are the various options? Like I heard there is this one thing called FY2 standalone training program or a non-training job that one gets itself into. So, boss, which one is better? Or which one would you recommend?
Um, which one would I recommend? I would say that having a training job, which is an F2 standard first, is always better than having a non-training job, which is a trust-based job. Having said that, I myself did not do an F2 standalone because when I was applying, they were all filled up. So basically, at the time when you have got your registration, you look what vacancies there are. So there's NHS jobs.nhs.uk, then there is track jobs. So there are a few websites that you make your account on, and you go on to see which jobs you're eligible to apply for. The eligibility criteria will be quite streamlined, and you'll always know. So you will be able to apply for most of the senior, junior clinical fellow jobs, non-training, not trust grade, and F2 standalone. Now, I would say it's okay, whichever you land, it's completely fine. You have more rights and you're more protected if you have a training job. That's for sure. So the really has your back. But the system is quite fair. So even if you get a non-training job, it's completely fine. I had my registration in May 2020, and then I started applying for jobs. I was at home in India. I did a few interviews from home, and then I just moved to UK in September to start my first job as a non-training trust grade doctor and trauma and orthopedics.
Okay. Okay, boss. And boss, do we have to uh, tailor our CVs in a certain way, so that it becomes easy for us to land a non-training job or an FY2 standalone training job?
Yeah. So UK is becoming quite a popular option. So lots of graduates from around the world and even the US, Canada are coming here, which does make it more competitive. What I would say is, and actually at this time I'd like to actually say this, that you guys are doing an amazing job. Because when I was in SMS, we did not even think about research. And all our focus was on just passing the exams, going for the PG exams, and maybe having some fun along the way. But research is a very, very important part of actually being a doctor, which I only realized when I got here. So, if you have time, I would say while you're in your pre-final and final year, even before that, try and do some sort of get involved in researches, even if you can't really finish it. Just the experience of it and being able to say what you learned will bring you kind of give you an opportunity and kind of edge over the other people. Second thing would be to know about clinical governance. They really appreciate people, IMD especially, to be talking about audits, quality improvement, things like that. Um, and it could be anything, very, very tiny thing. While I was in India and working, I unknowingly actually did an audit and I did not realize that I did that. And during my application process, I was thankfully able to use it to actually say that, yes, I know about this. And so that I think scored me some brownie points. And then after all of that, one more thing that might help you on as compared to the other applicants would be reading the GMC Good Medical Practice document. So it's not, it is quite a long document and you don't really need to know it by heart. But the basic principles, they might want you to talk about them during your interviews once you get through your to the interview phase. Talking about how good a team player you are, how you actually brought change if there was any, talking about how you applied good medical practice in your workplace if you have work experience. So these things definitely give you an edge. ALS courses, if you can manage to find that, and that doesn't have to be in the UK. If they are able to see that you tried and you have managed to get some sort of situation, that will automatically make you more desirable for them as compared to people who haven't.
Okay, so one should try to get involved in as many research activities and audits and clinical governance as possible.
Yeah.
Okay. Was also there is this thing that the internship, the compulsory rotatory internship in India is just of 1 year, and in UK it is of 2 years. So to fill up this gap, the people get enrolled into this FY2 or the foundation year 2 training program. So can you please elaborate on that too?
Yeah. So thankfully, our internship they do count that as an F1 year in UK. Some other colleges and some other countries don't have that privilege. So basically, our internship counts as F1. We do need to produce all the evidence, so all the logbooks will get signed and your completion certificate.
Okay.
They will want to see that to say that fine, F1 done. Then, if you get an F2 standalone job, then you get signed off like the other F2s, Foundation Year 2 trainees. If not, if you're like me and get a non-training trust grade job, you might actually be able to get it signed off sooner. So, depending on which department you're in, there will be someone, a senior, most likely a consultant, who will be able to sign the CREST form for you. And they don't do that in less than 3 months duration. So you have to be working there at least for 3 months, demonstrating that you're getting competent on those things listed on the form. And between 3 to 9 months, most of us will be able to get that signed off. And then you can actually go on to apply for specialty training if you'd like.
Okay, so boss, we need to get that CREST form signed to be eligible to enter into the specialty training.
No, F2 competencies.
Okay. So, boss, what are talking about specialty training over here? So, boss, what are the various specialty training options available to us?
There are lots and lots of options. And in fact, unless you're actually going for that specialty, it is very difficult to figure out what pathways there even are. But generally, there is obviously the surgical types, there is the non-surgical types, medical specialties. For surgical jobs and training, you basically need to have a different type of approach. They will expect you to have done your MRCS before applying. They will expect you to have a portfolio that already reflects some surgical competencies and how many surgeries you've been a part of. It is quite competitive, but you will be, compared to their own graduates at the same level. So it's completely fine. It's not like you're not going to be considered in the first match season or something like that. So it's completely fine. If you are able to do all that, you will be equally offered the opportunities. Then there are specialties that are medical, such as general practice, pediatrics, then you have medicine. They have different sort of pathways. Pediatrics itself is actually a run-through program, which means you have ST1 to 6 or 7, and you don't have a break after core training, and you actually can go through the entire pathway without having to do another set of interviews,
Okay.
which is not the case with specialties that make you do a core training and then a specialty training, which is medical and surgical. So
Okay.
you do your in some specialties such as medicine, general medicine, you'll be doing core training for 2 to 3 years, and then once you've done that, you will be you will need to apply for jobs again in specialty training. You could be doing things like dermatology, respiratory, things like that. And dermatology is again very popular here, even among IMGs. So that's very competitive, very good. And I actually got the opportunity to work in one of the leading dermatology departments in the country, and that was amazing. And that did make me think that I want to convert, but no, I mean, um, so I went for general practice, and the reason I did that was I don't think I have the easiest answer would be I did not have the attention span to actually get good at one thing, and I just lose interest very quickly. So I just like doing a lot of things at the same time. So it was either for me general pediatrics, general medicine, or general practice. And general practice was like endless opportunity, so I opted for this one. So with respect to application test,
Hmm.
you'll be for general practice, pediatrics, quite and psychiatry, it's quite similar. You'll be doing your MSRA exam after you get your
Okay.
F competent or your F
Hmm.
competent. For MSRA, again, there will be resources, question banks, notes, things like that. You do the MSRA. If you pass, then you get to actually give your choices. There are loads of NHS trusts and pre-navys. You get to rank them in the order of your preference. And yeah, depending on how much you've scored, how many people are above you who also want the same position in the same hospital or uni, you will be offered something. Sometimes you might not. So this one's a bit more competitive than your clubs.
Okay. And boss, do we need to tailor our CVs in a different manner for getting into a specialty training, or is it the same as before?
Um, it will differ depending on which training you're trying to get into, but
Hmm.
you will be able to actually find all of that once you're trying to look into the job applications.
Okay.
So they will. There's a very nice document for every job, every training course, which will tell you what all you should definitely have and what things that they prefer if you had. So you will be able to tailor, and down the during the whole path where preparing and thinking what you want to do, you will come across people who want the same thing.
Hmm.
So you will have a good network of people who will have more ideas, and it's not that hard to figure out once you know which path you're going to.
Okay, boss. Okay, boss. And boss, are there any hospitals or deaneries, as they say, that one should aim for while matching into these specialty training programs?
Not really, actually. Of course, there are institutes, there are
Hmm.
universities, deaneries that are thought to be amazing for medicine. So here, I think Oxford again, as if you were to be an undergrad and trying to do medicine, the first option, as in, I would say, the most sought after would be Oxford. But having said that, the training is very standardized. No matter where you are in the country, you will be going through the same set of competencies. You will be expected to do the exact same portfolio, having the same things signed off, and you will all be doing the same exams. So, say for example, I am in Oxford and my friends in Gloucester, we'll be doing the same exam, and we'll all have to answer the same questions, and depending on how we do, we either pass or we fail. And these exams get obviously tougher and tougher as you get into a specialty. But yes, you can go anywhere. Lots of people like to choose their options depending on where they live. Lots of people will already have families when they're doing specialty training, so they actually like to stay close to their family in the same city. For me, I did not have a family by that time, so I was free to choose what I wanted, and I wanted to go to Oxford, and I thankfully got it. So it's just like that. It's not like any place is inferior to the other.
Okay, so it is more of a personal choice.
It is a personal choice, yeah.
Okay, boss. And boss, since you've worked in the NHS for such a long period now, so boss, can you please share your experiences, like both professionally and personally?
Um, well, NHS is, of course, there are pros and cons to working anywhere. NHS is the government medical hospitals in UK and the GPs. Very small percentage is private hospitals also and private clinics. They are getting more now, more in number and percentage. But anyone who's coming in the country, they'll probably want to start with NHS and at least in some capacity be associated with NHS indefinitely when they work as a specialist or a generalist. Um, the best thing about NHS that really drove me here was that it's very fair, and you don't have to really. The struggles here are different. You basically are always allowed to say no if you need to. You can always raise concerns with someone if you're not feeling right about a certain person, or in some places rarely if you're experiencing bullying or just a bit of bias, discrimination. It is absolutely not accepted. So you can very easily raise concerns, and 99% out of 100% you will actually be supported, and there will be a solution to the problem. Also, there's equality, so people are treated all the same, which is something I really like. Um, I would say there is barely any discrimination, and celebrities and royals and the general public, they will all be given the same level of medical care. So there is no preferential treatment, which I absolutely adore about the NHS. Um, Other than that, there are some difficult things. You are expected to be able to, at each point in your day, in your career, you might be asked, why did you do a certain thing? And you should be able to actually um, prove and provide evidence that it was the best thing, safest thing that you could have done in that time. And the medical legal implications of your practice are a bit more serious here. You are expected to have a very high level of note keeping for each and every interaction you have. You are expected to have your practice compliant with the recent guidelines, and the guidelines will always change. Something will change every month, and so you'll be expected to really be on top of everything. Um, there will be a revalidation every few years, that will go through what you have done over the last few years, and if there is anything that they think you've not done well, they will ask you to provide more evidence and do something more. Otherwise, you will not get revalidated. Um, of course, the environment is a bit different, and yeah, I mean, one thing that being an Indian, I feel could be a pro or a con depending on what you like is you're never as free in any other place like you're in India. Not just as a doctor, but just as a citizen of the country. In India, you get so much freedom, and you get to do so much that you don't anywhere else in the world.
So boss, NHS does sound to be remarkably and like admirably a fair and just association, but it is medico legally a little hard to work over there. Okay. And was is it worth moving to the UK as a doctor, like with respect to the lifestyle and the career progression and the finance?
Um, Again, I think here what really makes a difference is whether you get what you want. That's why it's really important to know who you are, how you are, and I think not even just as a medical professional, as anyone in any part of their life, any phase of their life, it's very important to know yourself, what you like, what you're good at also, and what there is a demand for. Um, it is definitely worth moving, but you should consider the negatives that come with moving to UK. For me, the biggest negative would have been weather, which is extremely, completely different to where I grew up in Jeddah, and I'm so used to the heat. But I rarely see sun here, which is it doesn't make me happy. And there's obviously a lot of prevalence of seasonal affective disorder, depression, yeah, which makes sense. So
Hmm.
there's that, and something else that you should consider, which could again be good for you or bad for you, depending on who you are, is life is a bit simpler here. Um, in most of the areas, which are not huge cities like London or Bristol or Oxford, you will places will close in the evening. They will close at their designated time, and after that, yeah, you get out of the house at like 8, and you might not find a lot of places open. Cafes will not be open at that time. Pharmacies will not be open at that time. So it's simpler, and people value their off time with their families quite a lot, which I really like here. And there's no inferiority in saying that, God, I have a husband or I have a mother who's not well and I want to go home and help them out. It's completely fine to tailor your job to that.
Hmm.
Um, and then, of course, for me, it obviously worked out well because I met my husband here. So I'm happy. But for someone else, I don't know whether the weather and all of the different circumstances changes will sit well with them.
Okay, so it is personally, it depends, or individual to individual, it may vary.
Yeah.
Okay.
It's
And
really
was
important to consider what you're getting into.
one should be aware of what we really want, and then only can we make a decision. Okay. And was this is a bit of a personal question, but what has been your best memory in the UK so far?
Oh, memory. Thank you for asking this before. Okay. What was my best memory? Well, I've been here almost 5 years now, and lots of good things and lots of very, very difficult times have happened. I have had periods where I was not very well health-wise, but I guess, yeah, it's probably not very professional, but yeah, my best memory would have been when I saw my now husband come to see me for a date for the first time. I saw him walking away, and I guess that's the best thing I can do.
Sounds so cute.
Yeah.
Okay. And was now the last question, or the 13th question. So was is there a,
You
I'm sorry?
you cut out there, baby. I don't know what you said in the last 2 3 seconds.
Was I'll repeat it again. So was we are so was now the last question of the session. So was is there any golden piece of advice that you would like to share with those aspiring to work in the UK as a doctor?
Um, Not just in UK or anywhere else, but I would say that obviously saying that we've all obviously become either doctors or we are medical students. We obviously work very, very hard. It's never easy. Um, so we know that you can dream as big as you want, but I just want to say that it's no dream is small either. You
Hmm.
can want what you want, and just do it with a true heart, and just always have a plan. You will always have a direction. If there's any hindrance, any problem, you will still find your path. If you have a plan and you have an idea and you want to work for it, it'll be absolutely fine.
Thank you so much, boss, for this advice. We'll definitely try to stick to it. Was also we have a few audience questions, like
Oh,
the one. So, what will you please answer them too?
yeah, yeah.
Okay. So, boss, the first question is that how is the preparation of PLAB different from that of NEET PG?
Okay. So it's completely different. For NEET PG, you are expected to know a lot of things in a lot of detail. But for any exam in the UK, for whichever level you're trying or applying for, they will want your knowledge to cater to that. So with labs, you're expected to be a junior doctor. So
Hmm.
you will not be expected to know in detail about everything. You will have a curriculum, and it is definitely easier than actually preparing for an extensive exam like NEET PG. But then again, there's a lot of competition.
Okay. And boss, the next question is that how did you manage your preparation for PLAB along with internship?
I actually did not. I hadn't decided around the time, but you can. Uh, the major difference being that in PLABs you needed to apply your knowledge, whereas in NEET it's more a theoretical exam. So just if you get into a habit of actually applying the knowledge you have, you will be able to crack the exam. If you're doing it with internship, probably give yourself more than 3 months time to familiarize yourself with the question bank first. And once you think that you're ready and you're able to, then just apply for the exam. It's
Okay,
not
boss.
going to be that hard with internship. It's okay.
Okay, boss. And the third question is that how is residency in the UK different from that in India?
Residency is quite different. You do get a lot of time actually. Most residency pathways are much longer than they're in India, such as pediatrics will be 6, 7 years or longer, depending on whether you've had a break. Surgical pathway is much longer, depending on which specialty you're in. But the common thing is that it is a streamlined pathway. It's standardized throughout the country, and all of your colleagues who are doing it in another part of the country will have to actually go through the exact same competencies and portfolios and set of rules to really qualify in the end.
Hmm.
One good thing is you are allowed to really raise concerns if you have to. Um, Deaneries are quite interested in actually getting us through the training, so they don't really try and find faults. They actually try and nurture you more. So it is more of a growth environment. Whereas in India, most of the places are like that, and it's actually much better than it used to be. But yeah, sometimes it can depend on which department you're in, whether you get along with your seniors or not. So it can be variable, which is one thing that does not happen here. It's quite similar everywhere.
Yes, it is true that the situation of residents in India is a little grim these days.
Um, Grim with respect to probably they don't get time to do anything else.
Hmm.
Obviously, turned out to be brilliant trained
Yeah,
doctors.
no doubt
But
about that.
yeah, I mean, there's just a bit of issue with obviously getting time, work-life
Hmm.
balance. If you have children, it can get very difficult.
Hmm. Work life balance is actually something that the Indian administration needs to work on with respect to the doctors. Even I feel
Mm.
that.
Yeah, I mean, most of my friends who are still working in India, they still feel like they're not getting their dues because they've worked so hard and they're not as appreciated as they're brilliant and their pay does not reflect that. The way they're treated rarely reflects that.
Okay. So was this was all the audience questions. So with this we have reached towards the end of our session. Was it was really kind and generous of you to have answered all of our queries with so much patience. And I really hope that anybody who stumbles across this video in the near future will find it very useful.
Yeah, I hope
Thank you.
so.
Thank you so much, boss. It was really wonderful having you here. And so that was it for today. Thank you so much for watching.
Thank you for having me. It's completely my pleasure, and I love doing anything that is associated with SMS. And kudos to your great effort, guys.
Because actually, I cannot put it in words that how big of a blessing it is to have seniors at like you at such eminent positions all across the globe and who are also so keen on guiding and helping their juniors out.
Well, yeah, we'll always be. It's almost really like kind of a family that you have SMS alumni. I mean, I have some seniors that I still get guidance from. So it always feels like, you're a part of a family and you're always looking out for each other. You always feel like that no matter how old you get. So it's a good feeling.
Yeah, thank you so much, ma'am.
All right, bye bye. Thank you for
Bye.
having me. Bye.